Welcome back, everybody, to another DocTales with Cocktails episode of BS Free MD with your hosts, Doctors Tim Hindmarsh and Dr. Retired May Hindmarsh, where Tim talks about the latest news, quackery, and brings his own spin on things. Today, he's got some crazy stories for us, including, he found the strangest place to do genital surgery. And I don't want to know how he found it, but we'll get to that. Also, there is hope and therapy for your obese pet cat. Not everyone in the world of weight loss drugs has to suffer without their pets getting help. So we're going to dive into that. We also share our update that we just did with Dr. Peter McCullough on our recent podcast interview. And Tim's going to share his cocktail of the night. Plus, I have a little tidbit on some fun genetic information if you've ever checked your earwax lately.
Let's take it away. This is just a couple months ago, October 21st of 2025. Pitaya Mulin, a.k.a. Chang Yai Modify, a 51-year-old non-surgeon, got caught in, you cannot believe this, an undercover sting operation doing genital surgery. In other words, male penis enlargement and pearling procedures, as well as circumcisions, in the back seat of his 1990 gray Toyota Corolla. Yes. And so this is in Thailand. And I was wondering, like, how did he get caught? Like, was it the parking maid that caught him? Because you parked too long time.
First off,
and then she looks in the back and she's like, what in the world is going on here?
How did you find this, first off?
I don't know. I have a feed.
What's the feed?
Well, then of course, it's like purling.
Okay.
And I don't know what purling is. So then I looked it up.
You had to look it up.
Which is, don't look that up at work. And then apparently it's like taking pearls or things like pearls and putting them under the skin of your penis to, I guess, make it like a human French tickler of some form or other. And I'm sitting there and I'm like, okay,
I'm thinking
you could put me naked on a desert island like Tom Cruise in that movie with Wilson the basketball, and I could be harvesting pearls all day long and then eating the oysters, and never would I ever in a million years think that somehow putting pearls under my skin would be a good idea or would somehow enhance my life. It's like, what do people come up with?
Rewind the tapes to even think how they get to that point. Well, people have been shoving things in orifices since the beginning of time. We've seen plenty of it in our careers, in our practices, removing them. I have never had to remove an oyster pearl, but a lot of things like it.
Yes.
Are you going to comment on that?
Yeah, well, we can only go into.
But I'm thinking of all the sanitary places,
Well, the backseat of a 1990 gray Toyota Corolla, and of course he had no medical training, and he learned it on the internet.
Of course he did.
Right,
But
then it was an
see one, do one, teach one.
But it gets better. It was an undercover sting operation.
Yes.
Never in the history of mankind have the two words sting and operation in combination been more descriptive of what actually happened. Because I'm sure it stung a lot.
Maybe they had some of this for anesthesia.
Maybe they did. Because that would be somewhat effective.
That's not a procedure you've ever done in.
Well, I did a lot of circumcisions.
No. And you've.
So I had a circumcision. Do you know my circumcision joke?
But you want to tell the story about
do you know my circumcision joke?
Tell that.
So the parents would bring in, their lovely little boy, because we know they're boys because they had penises, and lay him down there, and I would do this penile block procedure where, you put a little bit of local anesthetic around,
Because
he's 11 o'clock, 2 o'clock, 6 o'clock.
Baby, you gotta be.
So you want to try to anesthetize them and be nice. So I would do that, and I would say, "Do you know?" I look at the parents. I go, do you know that penile anesthesia was invented by the ancient Egyptians? And they'd say no. And I'd go, yes. It was called Me Got Numcock.
Oh my gosh. That's such a bad dad joke.
It's a bad dad joke, but it's like, it was perfect.
A bad Dr. Dad joke.
Yes.
I was thinking in reference to, you never had to do any pearling surgeries, but you didn't you get asked to do some crazy, didn't somebody want some kind of
yeah. I had an
implant?
Yes, there was a patient,
a pterodactyl or something.
There was a patient that got so sick of doing his own drunken prison tattoos with like they'd sterilize the needle at home and then just poke themselves.
Yeah.
That he bought his own tattoo gun, and so he could get even more crappy tattoos in higher volume. And he was like, you could just put in the little stegosaurus screw-in spike thing.
The screw-in spike things on the scalp. Yes.
So that is what they wanted.
But you didn't do it, did you?
Of course not.
Oh, come on. You could have done that in the back of our gray pickup truck at home.
Well,
for some good
I
cash.
did do a vasectomy for 1.7 liters of whiskey, though.
He did.
I traded. That I did do.
He did do that. And then we went out for lunch with him at Sherry's, all four of us.
Yes.
A little family friend right there for you.
Yeah,
you know who you are.
That was good. You know who you are. Exactly. So tell us, May, about earwax.
Oh.
Let's move to that one,
okay,
and then we'll do the meow trial.
Okay, I've been a little obsessed with this website called geneticlifehacks.com. And, if you're interested in anything to do with your genes, epigenetics, or you have been one of those few people like me that have gotten genetic testing, it's actually very useful. Or even if you don't have all your data, you can look up hereditary type things on there. But they have some fun stuff. And lo and behold, I found this, and I couldn't believe it. There is a gene, because there's a gene for everything, called the ABCC11 gene.
There's a gene for everything.
But
they haven't found the gay gene yet. Sorry, I just had to add
I should actually type that in, because maybe
had to add that.
This gene encodes, or it will tell you what type, not only what type of earwax you have, it goes along with something else. It's connected. And so I don't know if you're one of those people that notices if you have like really wet earwax or really dry, itchy, crusty, but that's genetic. And if you have dry earwax, you likely have little or no BO. Yes, if you have the wet, goopy earwax, then it's likely that you have high BO. And they have found that a change in this DNA gene can change and flip, turn off and on, and change whether you have much armpit BO. And in fact, it does have to do and flip over with the type of bacteria in your body that produces and interacts to produce more sulfa, and actually is related to the glutathione levels in your body.
So basically what I'm hearing you say is the next time you're on the bus and someone just smells like a giant armpit, you can look at them and go, I know, you have a lot of wet ear cheese.
There you go.
You are an ear cheese master.
Yeah, so
I can smell it from here.
So there's a bacteria, Staph hominis, that then multiplies and gives you that BO smell. But however, it's pretty fascinating because in apparently Europe, like there's very low percentage of people that have that gene, like 2 to 3%. However, in Asia, it's very common, and I think almost all Koreans have this genetic variant where they don't produce BO. And then it goes on. It goes on.
So they have the gene where they lack the gene, and then they don't make the cheesy earwax, and it makes them have less BO. Is that correct?
It's the gene variant, right? Yes.
Okay. So is that gene variant also? Again, you said because it was Koreans. Does it also make you a shitty driver, or is that different?
They did not correlate that. No.
I was just asking.
Did not correlate
asking
that.
for a friend.
But they went on to try to then do a study about people using deodorant, even though they don't produce BO, and they found that most people still use it all the time because it's just like a personal,
Yeah, but you
part
can't
of hygiene.
smell yourself.
A personal part of hygiene, and they don't really pay attention. So
The
that most
smelly
people.
kid in 8th grade didn't know he was the smelly
I
kid.
mean, you weren't that kid where your mom's like,
No,
start
I
wearing
mean, look.
deodorant,
Well,
darn it.
yeah,
you
but I
stink.
mean, like, look, you go out. This is exactly what Jeff Foxworthy talks
It's like
about.
wash
He
your
goes-
face, brush
he
your
goes,
teeth, and put on
He
deodorant.
goes, the difference between men and women is when a man smells something absolutely horrific, he has to keep smelling it and share it with his friends, right? It's the hockey bag or the gym bag. It's the, oh man, that gym bag's awful. Dude, you gotta, and it's absolutely true. Like, there is probably nothing in the entire known universe that smells worse than hockey gear.
Oh, that's
Because you sweat right through that, and it's like a million maxi pads stuck to you that all absorb your sweat. And then you don't wash that stuff because washing it is a pain. You have to let it dry for such a long time.
because you're a
put it
man
in
and it's a
winter.
pain.
So if you washed it in Saskatoon and left it out, it would all be frozen. You would have like literally a sweatsicle out there. So you wash it once a year, and then it sits in the bag that you throw into the like your house or your garage, and it's just like it is literally bacteria just
Multiplying.
It's bacteria in a PDD freak off in that bag.
It's a fungi.
Going
festival.
crazy. Yeah, it is. It's a fest. What?
Oh, it's
Finally, when we moved, and
Oh my
I picked
gosh.
up my hockey bag and I looked at it, and I said, if I'm gonna play hockey again, I'm getting new stuff. And it went straight into the.
I think it disintegrated before the
Straight into
dumpster.
the dumpster.
That was so gross.
Yes,
It is true.
it is true. So well,
Sweaty,
there we
like
go.
sweaty gym socks right there.
Yeah. No,
Anyway.
it is just crazy.
You don't need to do the gene test. Just get your Q-tip in
just
your
don't
ear
need to
and
do-
smell your
just-
pits, and you'll know whether you have that gene or not. All right, what do you got?
Meow One trial.
Oh yeah.
So they did a big stretch on this because they
I'm
got
thinking-
Meow out of management of obese cats.
I'm thinking goodbye Garfield.
Meow.
No more
Yeah,
fat cat
no more
lasagna.
lasagna.
Why? Because
50 to 61% of cats in the United States are obese. And so they invented they're studying a GLP-1 implant, basically Ozempic for cats. So you inject this thing in there like once a month or once a week or whatever it is.
Ozempic.
And then your cat eats less food, and then you don't have an obese cat, and because obesity in pets, significantly shortens their lifespan.
And
then I was thinking,
injecting your cat.
injecting your cat. And then
There's some fun.
Then I was thinking, you could inject your cat, or you could
And
just
spend $500 a month, or you could just pull the food dish away.
exactly because last time I checked, cats don't
Drive
have
to the grocery store.
opposable thumbs. If you put the cat food behind a door where you have to turn the knob to get the food, the cat can't get it. And the cats that go out and hunt, they're not morbidly obese because we've had tons of outdoor cats. We inherited a morbidly obese
yeah,
cat.
we did.
And we had to send him outside because he was so skittish. And he became a hunter. And then he became a hunter that needed a tummy tuck.
You did
Because he lost
try.
so much weight. He had an entire scarf of extra cat fur and skin that just like flapped around, like kind of like the bottom of an uninflated wingsuit.
It was.
It was unbelievable. You could have made a scarf out of his abdominal
It looked
skin.
like a flying squirrel
Yes.
with extra skin.
Yes.
It's
So,
true. So
All he
I'm
needed
thinking,
was exercise and a steady diet of small rodents.
I'm thinking
and he was fine.
there's no bat flying chance I would be injecting a cat on the weekly, because that's torture right there.
Well, remember we had to give a cat eye
cut
drops?
Try to cut its toenails, for heaven's sake.
Yeah, no, it's
I
terrible.
mean, I guess, mind you, you can grab the back of their fur, just like you give them, giving them the flea medicine. They get to know it's wet, but I'm thinking a waste of money.
So
I don't know.
it reminds me,
That's
though, okay, it reminded me of the single greatest commercial in the history of the world, which is what happens if cats had opposable thumbs. Let's have a look at this.
Why do cats stare when you're pouring milk? It's like they know it's only a matter of time. The only thing between them and opposable thumbs. Imagine that. Cats with thumbs. And what if they got together? Gangs of cats with thumbs. An organized army with one thing on their mind. Craven Tales. Well, jog on.
Yes. Kitties with thumbs. And it's British too.
What
which makes
a
it even
great
better.
ad for milk.
Yeah, I mean it's just genius. But you think of that, right? It's like you're a cat, you're giving a thumbs up. And it's just you have a. I remember giving talks about this, about obesity epidemic in the United States, and about how obese pets. And I'm like, last time I checked, I have 100% control over the bowl, the dog bowl. And my dog will eat, our dogs would eat anything. Remember Stewie? He would run to the neighbors and he would eat piles of cow crap. And he would come home and his breath would just reek, like you knew exactly what he was doing. And I'm like, that is a creature that will literally eat anything. So if you just don't keep feeding it or don't give it treats, it probably will lose weight.
Unless he runs to the next door neighbor's cow patch, although there's not very many calories.
Remember when our other dog ate that like 700 pounds of somebody's leftover spaghetti? It was unbelievable. So yes, it's coming. GLP-1s for cats. And honestly, look, if you're killing your cat and this helps and you want to pay for it, I have no issue with it. We are actually pro GLP-1. We are not anti GLP-1. I think that for some people, they actually do have a GLP-1 deficiency. I think that may actually exist. I have seen some amazing success stories. And this is a great segue into our interview with Peter McCullough, where he's like, seeing patients matters. When you can read all you want from influencers. You can listen to people that have never seen a patient and never written a prescription. And it's not the same as seeing somebody's life completely transformed by injecting half a cc a week, and in a year and a half, they're down 100 pounds and they're off all of their diabetic medications.
Right.
Now, I don't know if 10 years from now, we're going to find out that GLP-1s make you grow a unicorn horn or give you fungating butt cancer or whatever. But right now, this peptide therapy is very promising.
It's got to make you wonder if there's not a deficiency in that peptide in people, for sure. I mean,
right, and
think of it like insulin.
Well, but again, is it acquired, right? Like, do you acquire it? Like, you get to a point of obesity or hormone disruption or microbiome or all of these things we discuss, and then your GLP goes to crap and you get hungry and fat. I don't know. So we interviewed Peter McCullough, and we're gonna show us a short segment here. Absolutely. Completely mind-blowing. This was really one of my favorites out of all the four.
I mean, we talk about long COVID, how, I didn't, but a lot of the world's not talking about it. It's affecting so many people, myself included. He basically gets into the nitty-gritty of how it starts, what can be helpful, how to test and measure it. It gives me some personal insights and help as well. And yeah, enjoy this little teaser.
Let's watch this for a few minutes. Well, we call it a teaser for a reason, because you're going to want to watch that whole 1 hour and 10 minutes, because my mind was completely blown.
He's so honest and
he's such an easy guy to talk to.
Yeah, so transparent with his own stuff, and we've been honored to have him on the show so many times. And the guy has done such amazing research and advances and helping people, especially not just in cardiology, but in COVID and the vaccine world, which is a whole other thing if you've been keeping up on the news and some of the things that they've overturned. So grateful to have him on the show.
Yes. All right. Now we reach that time of the show where it's, what is Tim drinking? Because May's drinking ginger ale. And I've drank
a little ode to my
Canada Dry.
Country up north. Yeah, that's my favorite drink of the week.
It's good.
And yours is?
Carlotta's Revenge Rye from our friends
at the Loaded Cannon Distillery here in Lakewood Ranch.
Judging by how low this bottle is, the liquor fairy must have got into this.
I'm sensing that. I don't think it evaporated. But maybe the
And then
cat with the opposable thumbs that resides in our home under the tree
obviously,
has been into it.
obviously,
I will never tell.
cats with opposable thumbs. Drunken, can you imagine though? Cats with opposable thumbs on their ass drunk.
Well, I like to see what the sailor had
What
on.
kind of
the
things would they
pirate.
get into? Right? I mean,
Let's come up with a meme for that.
like,
I bet you we
and I
can.
think, would they be like trading stocks when you're gone? Right? It's like my portfolio is taking a dump, and how come we're buying like all this like pet food stock? It's because your cat has thumbs and is now
It's cat Govey
it's
stock.
got into your
Cat Govey stock.
yes, exactly.
All right, what else you got for us? Any other
Well,
thoughts of the day?
Yeah, a little bit. It was really interesting because, like, having interviewed Peter recently and going through, as we spoke about in last week's show, about how we're really getting to just the tip of the iceberg in a potential tsunami of chronic illness brought on by the spike protein, and in how this whole frickin' thing was started by basically manipulating people with a campaign of fear. And I always like coming back to fear because fear and safety have always been two really big deals to me. When our kids were young, I'd go out skydiving and I'd come home and my 5-year-old son would say, "Is skydiving safe?" And I'd say no, because nothing's safe. And you can do things, you can mitigate risk, but you can't make things safe. And this idea that you can be safe if you listen to me, or the vaccine is safe and effective. Nothing is safe and effective. Things are safe-ish and effective-ish. Things work. It's right patient, right dose, right time, right? And it's the whole fear-mongering that just drives me crazy. And so if you want to have a superpower, the superpower is to not fear, or more importantly, to fear the one thing that takes away all the other fears. And I've been listening to a lot of Patrick Bet-David's podcast, and he is a very positive guy. If there's a joyful warrior out there, it's that guy. I mean, he's been wildly successful. He's unbelievably thankful for his life. He was, born in Iran, had to wait 11 or 12 years to immigrate to the United States, has made a fabulous fortune for himself, very well-spoken guy. And it just hit me. He says over and over again, "I fear God more than anything in the world." You cannot believe how much I fear God. You cannot believe how much I want to make sure that I'm on the straight and narrow. You can't believe how much I am so thankful for everything I have. I have this life that's just unbelievable. I pinch myself. But I fear the man upstairs more than I fear anything else. And I think that if we ever, as individuals, get to a point where we really fear God more than anything else, you don't fear other things. Jesus is like, don't fear the one that can kill you. Fear the one that can throw you in hell. And, that's a message that not a lot of Christians want to hear, because there's sort of this kind of hell-free gospel. But that's Jesus. That wasn't Paul. That wasn't Peter. That was Jesus. Fear the one that controls where your soul goes. Fear the one that owns your soul. And so that really gets me. And then this one more thing, and then I want you to respond. And then it's like, okay, how do you deal with fear? Well, what's the opposite of fear? Well, it's bravery, it's courage, it's whatever. No, it's not. It's love. Perfect love casts out all fear. Not perfect courage, not perfect bravery, not sucking it up, not discipline. Love. Like, that's such a mind-blowing concept, because we don't think of that. We don't think of love and fear, but look at what fear does. It paralyzes people and it focuses them on, what they're scared of. And I've been a big believer that what you focus on, you become. You focus on your fears, you become your fears. Love makes you focus on others. It makes you focus outside. You focus outside of yourself, and all of a sudden your fear starts to evaporate.
There's a lot there. We could do a whole episode on this.
Well, we could.
Your brain thinks a little different than mine. And, those
especially after some Carlito
those are two
event.
big topics. I think it's very hard for some people, myself included, who have grown up or have this different distorted and image of God the Father and fearing him, because fearing him is to be afraid, and that means you're not deserving. And so for someone like you, it kind of connotes like something different. But when you talk about fearing God, a lot of us fear him all the time and don't think, we're worthy. So it just happens by accident, and it doesn't kind of fit in the whole paradigm of fear and love together, if that makes sense.
No, I think it makes tremendous amount of sense.
So,
And I've heard a lot of commentators talk about that. One
Yeah.
of the biggest barriers to people when they hear God the Father is that their father was so horrific.
well, not even
that
horrific,
they
either
can't-
absent, not just showing what fatherly
Right.
love is, just like completely absent, or horrific. You're right. And so not knowing what it means to have a healthy fear in respect of God, fear is just like, I'm afraid because I'm not worthy.
Yeah, and it
And
is,
so that's where, right away,
Right.
my brain stops, because there's always fear.
but it isn't fear that you're going to screw up and God's going to punish you. I think it's much deeper than that. And I'm going to have trouble maybe wrapping words around it, but there's two passages in the New Testament. There's two parables of Jesus that scare the absolute living crap out of me. And it's the parable of the talents, and it's the I never knew you passage.
Right.
Okay.
Right.
So the parable of the talents is Jesus gives these guys a measure. The landowner in the parable gives his employees a measure of money, a talent, like 10 grand or whatever it is. And one guy gets 1 talent, one guy gets 2, and so the one person goes off and reinvests it and blows up the money, comes back and says, I brought back your 10 talents plus 50 more, and on, and they're all well done, good and faithful servant. Some made tons, some made a little, but they all risked what they were given. Okay,
Right.
They all risked what they were given. Again, but the one that was scared of disappointing the master saved his money and did not risk his talent. And he was cast into the lake of fire because he was not just wicked, he was wicked and lazy. He was wicked and lazy for not risking what God had given him. That is so sobering.
Yeah.
So your fear of God should motivate you to risk who you are. That's what that means. And then the other one is, you can cast out demons in my name, you can done miracles in my name, and I never knew you. Get away from me, you evildoers.
Right.
So
Yeah, there's a lot there.
who
That
do you
first one.
know, and what really motivates you? Because so many people go from fear to anxiety to fear to anxiety, and it's like they're tumbling through rapids, and they never go, okay, whoa. Do I need to be scared of this? I mean, Tucker Carlson talks about people that he has known that are 10, 15 years older than him, where they turn on Fox News and it never goes off. Like they're literally just like all night long, they just have the TV on because it keeps the dog company. And it's just a steady stream of like a diet of somebody telling you what to think. And you're just like, well, of course you're going to be scared shitless. That's how they motivate you. It's one of the greatest, it's the most primal motivator in the world.
More
is
like
fear.
being paralyzed by all the sports that you got to keep watching.
Right.
You can't do anything with your life because the sports are there to entertain.
Yeah, but we wrecked that. We wrecked that because we completely corrupted sports with gambling. So now
get
you
my
watch sports
point.
and you are legitimately scared your team's going to lose because it's going to actually have material, wastage of your life.
Those are distractions.
So
But
it's just
back to the parable. I mean, yeah, that's a lot of psychology right there, to be so scared of disappointing that you're paralyzed, literally,
but
by
that's wicked.
fear.
That is wicked.
That's the definition of wicked. And so,
Which,
guess we got a lot of work to do.
well,
Some of us.
yeah, I mean, but you risk.
Anyway,
That's why safety. Again, it's what C.S. Lewis talks about Aslan, right? Like Aslan the lion, who was the Christ figure in the Narnia series, and the Mr. and Mrs. Beaver ask, they're having this discussion with the children, and they're like, Aslan, he's a lion. Is he safe? Of course he's not safe. He's a lion, but he is good.
Well, and that's
the
the part we
point.
have to remember.
That's the point. It gives me chills every time. Of course he's not safe, but he is good. And I mean, that's what we have to remember. You know, whether we're scared of Toyota Corollas having operating rooms or kitties with thumbs or viruses and long COVID, this life is way more than those things. And sometimes it's just good to be joyful and, you know, have a little bit of rye and hang out with your best friend.
I love it. And since it's coming up in the Christmas season, let's remember to just focus on others, loving them, simple things, not be afraid to step out and show that whatever way it may be, not be paralyzed by your own fear to do something for a neighbor or someone, you know, that's been on your conscience to text, call, send a note, whatever it may be. So on day-to-day terms, just think of that going forward. We'll talk some more in the future about the big psychological stuff that pops into Tim's mind. Until then, we hope you tune into the episode and interview with Dr. Peter McCullough and a little bit more on our thoughts on long COVID and detoxing spike protein and all the delicious scientific stuff. Until next time, keep it BS free.
It's no secret that medicine is a bit, uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more, and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
But we try to keep BS Free MD as raw and real as possible. We can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.